is that at the same time, he's raised literally millions of dollars for different charitable organizations and other aspects of this community that are so very vital. I'm going to call up on the stage a gentleman named Norman Christopher. For those who don't know him, he works for Children's Hospital. He's been heavily involved in a lot of what Matt's done. You can stop that. And I'm going to have him say a few words for us here this evening as well. Folks, Norman Christopher.
Thank you. Thanks for giving me the chance to come and make a few comments. The first thing I want to say is I brought some slides so that you wouldn't have to watch this. And actually, the slides are representative of some of the work that Matt has done at the hospital over the last 10 years. Can you believe it's been 10 years? Matt, I've thought for days about what to say and how to script it, and you know, I didn't want it to be a Matt fest, but it's going to be. I am blessed for working at an organization that is razor-sharp focused on its mission. And that mission is exemplified by 3 promises. And I know that Bill Considine has said these often enough around you that you know them. The first, that we treat every child as if that child was our own. The second, that we treat every person we come into contact as if they were our family and the way we want to be treated. And third, that we turn no child away ever for any reason who needs help. And it's that last point that becomes really critical in an era of healthcare reform. We have a philanthropy mission at the hospital. Without philanthropy, without the support of the people who we serve at Akron Children's Hospital, without people, Matt, like you, who've really given their lives, their professional career and their personal lives to support the hospital, we could not exist. And I want to be certain that we acknowledge that. And I want to do that on behalf of Bill Considine, our hospital president and CEO, all of the staff, but most importantly for the families and the children that we serve at that institution. Matt, many of us don't really know you personally, but we know you intimately. You've not been in many of our homes, but you're in our lives. You've made a huge difference. You've impacted on people you'll never know. I know that I've heard stories. I knew of Matt 15 years ago. I first met Matt 10 years ago, and it was actually in the lobby at Children's Hospital. We've laughed about this story a little bit. I knew Matt as a radio personality, and back then he was a little bit rough around the edges. And being at Akron Children's Hospital, it's an institution with a culture. And there was a clash of 2 cultures that first year when Matt was at the hospital. And I have to tell you that watching Matt and watching the Radiothon grow together, Matt is the Radiothon, and I'm not sure how we're going to do this, Matt. You've made such a difference. You've raised more than $6 million in the 10 years that you've worked with us. You've brought along almost 5,000 change bandits who've raised $1.5 million simply by carrying jars around and asking for change and asking for support. In 2008, in that 1 year alone, you raised more than $1 million in the Radiothon. And for those of you who haven't participated, it's really a remarkable thing. I've worked in emergency rooms at 2 wonderful institutions, Metro Health in Cleveland and Akron Children's, of course, for the last 15 years. We see everything, and we see lives changed by things that happen, and our lives are changed because we're a part of that, and we're privileged to be a part of those people's lives and to have their trust so that we can help them. Matt, that's how I regard you. I'm privileged to know you. We're privileged to have this relationship between you and me personally, you and the hospital, the families, and the patients that we serve. So Matt, with that, I just want to thank you and acknowledge you from the bottom of my heart.
Thank you.